new analysis released today by the Congressional Budget Office says that President Trump's massive spending package will increase the national deficit by trillions. The president's so-called Big Beautiful Bill aims to cut taxes by more than $3 trillion. The CBO said today that that tax cut would result in an increase of the deficit by $2.4 trillion. It would also leave nearly 11 million people without health insurance over the next decade. It comes as Trump is pushing to have the final package on his desk by the 4th of July. The budget bill narrowly cleared the House last month, but now faces fiscal hawks there in the Senate.
Okay, to get more perspective on the potential implications of this bill, we are joined here by Dr. Miriam Parker, the Chief Health Officer for Lifelong Health, a group of community health centers across the East Bay. Doctor, thank you for the time. We appreciate it here. I know at Lifelong, you offer health care to people of all ages, all income levels, and those who don't have health insurance. How would the proposed reduction in the number of people eligible for Medicaid in this legislation affect the patients you serve?
We predict that it's going to have a big impact on the patient population that we serve. We serve the most vulnerable, those who also are the least insured. And what it's going to mean for us is that we'll have fewer resources to provide care for our patient population.
Does that mean then you'll have to turn people away?
No, we hope to not turn people away. We are committed to the population that we serve, but it just will be tougher. The lines will be longer. The wait will be longer. Folks will end up going to emergency rooms instead of getting primary care from us. So in the long run, it'll cost us more money.
Yeah, there is discussion about sort of how this affects the overall healthcare system, the healthcare economy here. I mean, there are concerns that if the number of uninsured rises, that more people will delay care, they might take on more medical debt, and then there's also this financial hit that hospitals and doctors could potentially take. Are those concerns that you have?
Absolutely. We're concerned on the financial piece. We don't know how much of an impact it will be on us at the end of the day. But if we look at 2010, when the Medicaid was cut, it actually cost the state more money.
So, Doctor, I want to go back to the legislation because the version that cleared the House, obviously we know that the Senate could make some changes, but it would change the Medicaid work rules. So those who are non-disabled would then be required to work at least 80 hours a month or qualify for an exemption, such as being a student or a caregiver. Would that affect a significant number of your patients?
Yes, because we have to have systems in place to record where people are working. Where are they going to work? How are the hours going to be recorded? We don't really have those systems in place to record work requirements. So that's another hurdle we'd have to cross. In the meantime, is it going to cause delay on someone receiving care?
Along with those work requirements, another aspect of this legislation is that it would remove coverage for those who are undocumented or in this country and don't have documentation. Do you know how many of your patients fit into that category?
We don't know how many of our patients fit into that category. What we do know is how many patients that received care after we had expansion, and there are a lot of different folks that received care insurance because of expansion. Of that percentage, the percentage that's undocumented, I don't have data on that.
And what about going back to that previous question about folks who are non-disabled, who are getting Medicaid coverage? Do you know how many of your patients fall in that category, again, in terms of those who are non-disabled who would now be required to work?
What I can tell you is about 36,000 of our patients receive care from us through Medi-Cal. The breakdown of that percentage I wouldn't have for you, but we're talking about 36,000 patients that receive care from us that have Medi-Cal.
All right, as we wrap up the conversation, Doctor, just give us a sense of how you and your colleagues at Lifelong are preparing for the possibility of some sort of significant cuts to the Medicaid program. We don't know exactly where the legislation will wind up once it makes its way through the Senate here, but what kind of preparations are you making to be able, hopefully, to continue to provide care to people who turn to you?
So for non-urgent care, we're encouraging care, it's escaping me, non-in-person care. Telehealth is an area where we're offering non-urgent care, which would allow more people to access care.
Okay.
Well, thank you.
To do more with less.
Right.
Yeah.
Thank you so much for talking with us about the potential impact here. Again, just a few days, a few weeks for the Senate to hammer out its version of this bill. Really, thank you for your time today.
You're welcome.
Okay, we